Good morning, everyone. Welcome back to Wellness Wednesday. Dr. Regina here, founder and CEO of Mobile Care Physical Therapy. Today's topic I would like to discuss is torticollis. What is torticollis? It's a Latin word for twisted neck, head tilt, or what we call a wry neck. It's a very common condition which occurs in adults as well as babies, infants, and small children. It affects boys and girls equally, and torticollis can be present at birth or can develop in kids up to 3 months after um, their birth. The affected muscles that are causing the torticollis is called sternocleidomastoid. So it comes from behind the ear and goes all the way to the front of your collarbone, right in here. And when the muscle is contracted, it causes the head tilt. So if baby is diagnosed with the torticollis, it's generally not permanent condition and can be remedied with the correct treatment. It should not be left alone thinking that it will resolve on its own. It partially can, but there are, causes that if left untreated, it can cause other issues. So it's best to really take care of it as soon as possible. So we don't really know why babies develop torticollis, but here are some of the reasons and causes. It could be due to the position that the baby is in inside the womb. It could be also that the uterus is too small for the baby. It can also um, occur during birth, especially if it's a breech birth or difficult first time delivery, but that's rare. And also when the devices are used like forceps or vacuum during the delivery. How does the baby and how does the torticollis present? So we have a tilt to one side, and then the head tilt to one side, and then the chin turns to the opposite side. So that's where we see this muscle, the SCM, will be tight, right? You see this contracting muscle. So that's what happens, and this is the position of the baby with torticollis. There's also flattening of the head at the back of the head or the side of the head, especially if they develop this flatness of the head from keeping the head in the same position when they're lying down. So also baby fevers, looking over to one side versus the other. Their whole environment they prefer on that one side because of that tightness. Um, Instead of looking to both sides. With breastfeeding, whoever is breastfeeding, they may prefer one breast over the other. So and they can get very frustrated with the other breast because of that tightness, because they can't lie on that side because it stretches them too much. And this is where mommies are getting frustrated and develop problems on the breast that they don't take, unfortunately. But this could be the cause. If you feel like you're struggling with breastfeeding and they're not taking the breast, don't just look at the latching and how they, take the breast and whatnot. Look at other things like torticollis. Look at the baby itself, not only the mouth here, but the whole body. And that will give you some answers. And one of them could be the torticollis. Also, the preference the baby that would have to sleep on one side versus the side that's tight. They also show frustration when they want to turn to the other side that's tight. So they again prefer that one side that they're looking over to. Some of the treatments, again, it's a treatable condition. Um, and we rather start sooner rather than later, and in time and with the right treatment, the condition will improve. it can completely go away. Tummy time, again, like I did the video previously, is crucial. And again, I'm going to stress it out that it's so important, and especially in this case, where if you want to avoid that flatness of the head, you want to put baby in tummy time. That way, they're not laying on their backs too much. And also, tummy time helps strengthen the muscles of the neck and the shoulders, and prepares baby for many other milestones down the line when they grow up. So, how does the torticollis affect the baby's development if it left untreated? So, it can interfere with speech because it affects your neck muscles, causing your head to twist and turn and lurch forward or backwards. It also impacts infants' development of vision, sensory processing, feeding, like breastfeeding, right? And fine and gross motor development skills. Um, for example, if there's a decreased head control and limited, you know, visual tracking, those are the main things that is affected by torticollis. Then we have also limitations of child's ability to turn head, to see, to hear, interact with, with people and the environment of the side that they're not able to turn to. It may lead to cognitive development eventually and delayed just the whole body awareness. Um, that imbalance in muscle function and weakness of non-affected side can increase the tension of the affected side. That can, again, studied by Schertz et al., they found that because of that imbalance, it again affects early gross motor skills development. So those are the things that I wanted to mention that are very important when your baby is diagnosed with torticollis. So now I want to talk about some of the things that we can do um, to really work on the torticollis. I'm gonna show you my three most favorite ones. This is my baby boy. Say hi to everyone. So first of all, when you hold the baby, if for example their left side is tight, you want to hold them this way. And what's going to happen here is as you hold them this way, you're stretching gently their neck muscles. So if they're tilted to the left side and you're holding, your hand goes along this muscle here. And when you're holding them, they're gently being stretched. Okay? So if they're really uncomfortable and they show discomfort in this position, you can just gently rock them, and that usually helps them to soothe and tolerate that position a little bit longer. Also, facing the baby towards the environment is going to help them get distracted and tolerate this position of stretch. When you're feeding the baby as well, if you're bottle feeding, you can hold them on that left side when you're bottle feeding. So kind of doing this as you're feeding them, okay? And that while they're eating, they're being stretched, okay? I also do just manual stretching like so. So if they're tight on the left side, you want to open it up. So moving the shoulder down and moving the head to the side. Now, and the third one, most important one, is changing the environment. If the crib is in a place where they're preferring to turn, let's say the left side is affected and they're turned to the right side all the time, their environment is on the right side. So don't do anything with the crib, but put put their head on the other side of the bed. So this way, they're turning, their environment is, there's nothing going on basically. It's gonna force them to turn to the left to where that environment is. And also, um, like if they're older and they're sitting in a high chair, again, you want to put everything in a way that their environment is going to force them to look towards the tight side. All right, so these are my 3 favorite tips to stretch and really start the treatment with the kids that have torticollis. I hope that this was very educational and informative. If you have any questions, you can always contact me through my website, www.mobilecarept.com. If you like the video, put the thumbs up, and subscribe to our channel for more to come. If you haven't seen our previous videos, please do check them out. We have videos for pediatric PT and women's health physical therapy. Take care, everyone. Until next Wednesday.